Hello everyone and welcome back to our channel. I hope you are keeping best of your health, both physically and mentally, during this COVID pandemic. Now as the lockdown has been relaxed, most of us have started to go back to our workplace. In India, approximately 65 to 70% belongs to working age group population. Now related to workplace, the most common question what we get is it safe to go to work? And what should be done to protect oneself? Now to answer this, two factors has to be taken into consideration. Number one, being the personal health of the person, which includes your age and medical illness. And the second, the occupational risk of the person at his or her workplace. Now, to explain this in detail, I looked into an article which was published in NEJM on 26th of May 2020. It was by Dr. Marc R. Larochelle. Now in this, he had proposed a very simple framework for counseling about working during this pandemic. Let's get into this detail. Now if you look into this table, the vertical axis shows the occupational risk of contracting SARS-CoV-2 virus. At the bottom, it is low occupational risk, usually for person who works from home or are able to maintain strict physical distance. For example, IT professionals, teachers who takes online classes, medical reps. Now in the middle, we have got medium occupational risk. These are for person who can come in contact with people with uncertain coronavirus status. These are for people who works in banks, offices, be it private or government, shopkeepers, travelers, people working in law and order. And the topmost is for high occupational risk. These are for person who can come in contact with people with known coronavirus status. Usually for healthcare workers, hospital staffs, pharmacists, cafeteria, ambulance drivers. Now if you look at the horizontal axis, it shows about the risk of death from SARS-CoV-2 virus. Now at the left, you have got low risk of death, usually for younger age group population without high risk medical condition. In the middle, you have got medium risk of death, usually for middle age group population or younger age group population with high risk medical condition. And the extreme right, you have got high risk of death from SARS-CoV-2 virus. Now it is for older age people or middle age people with high risk medical condition. Now high risk medical condition includes obesity, diabetes, hypertension, cardiac illness, renal illness requiring dialysis, HIV, transplant patients, cancer patients and pregnancy. Now as a physician, we would suggest you to look into this framework and see which box you fall into. Now if you fall into a green box, it means you are safe enough to go back to work, but with proper necessary precautions. Now if you fall into this yellow box, you should consult your doctor for things that should mitigate the risk. Now if you fall into this red box, you should consider to stop working or should work from home, as you have got high risk of both contracting SARS-CoV-2 virus and also death from SARS-CoV-2 virus. Now let's look at workplaces. So now for people who are at a low risk workplace, like people working from home or are able to maintain a strict physical distance at his or her workplace. For example, IT professionals, teachers, medical representatives, etc. Now, first thing first, only when necessary, remember, only when necessary, step out of your house. This is probably one of the easiest way out to save lives. Now, companies should also encourage 20 to 30% of the employee to work from home. This will prevent gathering at the workplaces. And wherever possible, try to use video conferences or telecommunications for meetings. And the best example can be the online classes, which is conducted by the teachers and the professors of various schools and colleges. This has kept the education in the country going. And believe me, it takes immense dedication and time to prepare for online classes. Now even you work from home, you will go out to buy your essentials. So there too, try to avoid gathering. Before you leave your house, make a list of what you have to bring so that you avoid going to the grocery shops or supermarkets frequently. And for shopkeepers and vendors, I would advise you to minimize the number of customers coming to your shops. You can also advise your customers to book an appointment and come to your stores. Now for medium risk workplace, like your banks, office, shops, people who travel more frequently. Now as soon as you step into your office or shops, make sure that you clean your workplace before you start the day and also after you finish your day. Because you never know, the person who has cleaned your table or touched your racks, cleaned the shop, was healthy or not. Now at your shop's cabin or office, keep your windows and doors open. This will have a good air ventilation. Try to avoid using centralized AC. Instead, you can also think of using a negative air pressure ventilation. Now wherever possible, try to use your foot, your elbows or your shoulder to open the doors, operate your lifts and doorbells. Now always remember that this virus spreads rapidly in crowds or huge gatherings. Recently, after the lockdown was relaxed in Tamil Nadu, there was a newspaper picture showing the crowd in T Nagar. Probably that scenarios has to be avoided. Now common areas like cafeterias, meeting rooms, toilets, you have to be extra cautious. Avoid going in groups. You can take your turns and go and eat. Even in cafeteria, try to limit the number of people who are eating with you. You can reduce half of the chair in your meeting halls or the cafeteria so that you avoid crowd gathering. Now the next question which can come is, how frequently you should sanitize or clean your hands? I follow one simple principle. Always clean your hands with sanitizer or soap and water before handling any objects which do not belong to you or which you have not used for a long duration. Now I know that keeping your mask on for a longer duration can be difficult. So whenever you are alone, relax yourself and as soon as you come into physical communication, wear them on. And remember, the mask should cover both your nose and mouth. Because when you speak, you risk others, and when you listen to them, you are at risk of getting the infection. Now, coming to high risk workplace like hospitals, nursing homes, where doctors, nurses, pharmacists, ward boys, and other staffs are involved. So, whatever I have told about medium risk workplace, same applies here. At the receptions, minimize the number of employees, and every hospital has a protocol for protecting their employees. Hence, the employee should adhere to the protocol. They should use appropriate PPE as recommended by the hospitals. And as a healthcare worker, we should follow all the recommended safety measures in our workplace like hospital or nursing homes, and also when we are in the community, because we have to set a right example for the society. Now this COVID pandemic has changed the fact from survival of fittest to survival of the safest. So regardless to their age and their workplace, it is each and everyone's duty to follow all the safety guidelines properly and to take utmost care of themselves. And wherever you are, be it wherever you are, if you get any symptoms such as fever, cough, breathlessness, loss of taste, loss of smell, diarrhea, headache, generalized tiredness, fatigue, myalgia, or any symptoms which is unusual for you, please do not hesitate to see your physician. This will help you to improve your health and also to stop the spread. And now, if you have any queries regarding COVID or safety at workplace, please put down in the comment box. In my next videos, I can put them as a frequently asked questions and put forward to you. And yes, do not forget to share the video and also subscribe the channel. This will help us to reach out to many people. Always remember, one patient prevented COVID will worth millions. Thank you for watching and be safe.